shall now pray. Let's pray. Dear Lord, thank you for the honor and the privilege to praise your name through psalm and hymns. Thank you for your children who have praised your name this afternoon. Now, as we move to the next program, dear Lord, may you guide the speaker. May you speak to our hearts, and may we live here having experienced you. This we pray in Jesus' name. Amen. Yes, I cannot see Elder here, so I will take the honor. I can see Elder is coming. I now take the honor to invite this Elder to tell us what the afternoon looks like. Elder Charles, please take the mic now.
Happy Sabbath again and good afternoon. Yes, I wish to request that we settle down. We are past the time now. So this afternoon, like we said, we have a short session this afternoon from one of our guests, whom I'll wish to invite. But what is going to happen is going to make a short presentation and then open an interactive session with the audience. So like we did announce in the morning, Mr. Peter Mose is going to handle cerebral palsy and neurological conditions, issues surrounding there. And then members will have an opportunity to interact with the session. We have given him a brief and the nature of the people we have here. So I think he's well informed to handle this session this afternoon. Peter Mose worships at the Banana SDA Church, but he tells us his name is still with KMTC. He has never transferred it from there, and that tells you the background of his training. He's a physiotherapist by profession and doing private practice. And therefore, I wish to invite you, Peter. I know he has some slides to present the communication team, so you'll be able to support our speaker, Peter Mose. So, welcome.
Thank you, Elder, for this particular opportunity. I take this chance to appreciate the leadership of this church for finding it good for us to have this particular session. My name is Peter Mose. I'm a physio, as it has been said before, in the private practice with about 11 years of practice. I've been to quite a number of facilities, but until I now opted to be a private practitioner. And today we're going to cover basically cerebral palsy. I would request us to participate in the session because I understand here we have medics also in that field. Still on the same note, I also want to appreciate our speaker in the morning because she did cut and raise for us. She covered some of the areas as far as cerebral palsy is concerned. Bit of it though, because in our society we have stereotypes about people with disability, and by that, cerebral palsy is among the class, which can also lead to people having disability. Even though it has been advanced to a case whereby we no longer say people with disability or people with special need, we say people who are abled differently. Because me and you, we also have our own disability, be it a personality disability, anger issues, And also, we also have issue like indecision making. That can also be some bit of disability amongst us. But what we tend to note is the physical in other people, forgetting that we also have got our own disability. So, okay. When she was born, she was unresponsive for 2 days. The mother and the father having stayed for so many years without having a child, and she being the only child, she had to be put on a life support machine. The mother and the father took turn standing outside the ICU, waiting, hoping for a miracle to happen. The doctors and the nurses who were taking care of the child, because she was had a number of life support machines, did not give any hope as per the expression on the face. But the mother reluctantly stood by the door of the ICU, waiting, hoping for a miracle to happen. She continued. They tried to cancel her, to at least take a break, and also try to encourage her God was going to do a miracle. But she still stood there, hoping against hope, because that was the only child, and they were not guaranteed that they could get another child. Fortunately enough, after 2 days of being in ICU, there was some glimmer of hope, because the heart rate, the echo machine, echocardiogram machines, and ECG started recording heart and brain activity. At that moment, the doctors who really initially did not inspire any hope, because they had met similar cases before, and the results were fatal. So this time, they came out of the ICU room, and there was smiles on their face. At least this gave the mother the hope, and the father the hope. So this being the only child, as we have said before, so they hired the best team to continue seeing unto the needs of this particular child. So they hired physiotherapist, occupational therapist, pediatrician, speech therapist, to name a few. After a thorough intervention of this team, the child started gaining in terms of milestone. However, due to deprivation of oxygen, she did not fully recover, because she had issue with mobility, and she was confined to a wheelchair. But her cerebral ability was so super that she was able to go through schools, and later on she became the biggest champion of people with disability. And one of our quotes is, as people with disability, they don't need pity. They only need empathy. If it's your pity, you keep it to yourself. Okay, without wasting much time, we now go to our slide. And it's cerebral palsy. Perhaps among us, do we have anyone who has heard about cerebral palsy or know something about cerebral palsy, as far as the definition is concerned? Hello, church. Jesus is the Lord. Hello, church. Jesus is the Lord. Actually, the correct response should be, there is no controversy. Hello, Jesus is the Lord. There is no controversy. Okay, anyone among us who has heard about what cerebral palsy perhaps is? Msiogope. I'm told Parklands watu ni very courageous. Anyone among us? Anyone who has ever found or come across somebody with cerebral palsy? Hello? Tuko pamoja. Nobody has ever seen anybody with cerebral palsy, even if it is in the TV. Yes. You've seen. How do they present? Yeah, slurred speech. They have challenge with language. That's very good. Another person, please. Msiogope. Yeah. Another person here, problem with walking. And also another person here, I've also had issue with saliva, drooling. Yes, what else? Because these are people we meet from day to day in our life. Any other person? Someone behind there? You have something? Okay. Now, definition. Anybody who can just tell us what cerebral palsy is? A point for discussion, yes, my brother? Very, very good. Injury to brain, to an immature brain before birth. Yes, that's a very good definition. Very good. So actually cerebral palsy is injury or damage to an immature brain before something we call prenatal, during birth, which is we call perinatal, and after birth, called postnatal. Our brother was okay there. Thank you, brother. So there are things, we categorize the causes of cerebral palsy on the basis of those three stages. And the first one, where our brother said, the one before birth, that is prenatal. There are so many other causes, so many causes for that, for cerebral palsy in that stage, because we are told the brain in the first trimester, actually the entire nervous system in the first trimester is actively growing. Any damage earlier on in the growth of the nervous system that encompasses the brain and the spinal cord, can lead to a greater disability if there will be, or a greater need if there will be at that earlier in the development process. Unlike when the damage occurs much later during the third trimester. So there are factors which can also can lead to that, because it is an interactive session. Also maybe some other factor that can cause to that, because we know it is an injury. We have no idea. Yes, my brother. Yeah, very good. Poor handling during birth can also result into the injury to the brain. So these stages in the prenatal, we have issue like mothers who take drugs, for instance, alcohol and other drugs can result to injury of that. We also have exposure to radiations. That is perhaps when you go to an X-ray department, there's some instruction outside there to protect you. You are not supposed. There's a way you are not supposed to go into an X-ray room if it is you're expecting a child, and also in your first trimester. We also have other issues like blood pressure in pregnancy, which a condition called as toxemia. Toxemia is increased blood pressure in that the pressure between the maternal blood and the placenta doesn't balance. So the fetus is deprived of the necessary nutrient for the nourishment of the brain, and also the oxygen, resulting into damage to that immature brain at the prenatal stage. We also have something else called rubella measles, or German measles. That's also it's also known to cause injury to an immature brain. Maybe my communication team, if you can relay so that we go quickly. We've already covered that one. The next slide, please. Okay, something is immediately after birth, you may not be able to notice but that a child has cerebral palsy, unless in extreme severe case. This can be noticed mostly after 6 months, when the child starts showing no development as far as the milestone are concerned. And for this necessitates that those handling. For this case, the symptoms don't worsen over times because cerebral palsy is something called static. Only the injured part of the brain is the part which remains with the damage. It does not progress over time, like some condition like a tumor. For the case of tumor, it is progressive, affecting other part of the brain. So for this one, the condition doesn't change. What changes is how a multidisciplinary team which is going to influence the outcome of the intervention. Now that child attains some milestone. We go on. And the sign of symptoms we have seen there, we have muscle stiffness. What we mentioned earlier on, we have poor coordination. That's also something we mentioned. Involuntary movement which result due to injury. There is a part of the brain controlling specifically with refining movement. Because the brain is so much interconnected we can say, like in our day-to-day setup, we can say lines, connecting lines. In the brain issue, we have tracts. They are called tracts connecting one area to another. They may be cut. There's a part called the putamen. Putamen is the one if affected can result into involuntary movements. We also have difficulty in balance and posture. We have the part of the brain almost behind here called the cerebellum. Cerebellum control the movement and balance. If there is an injury to that part, we will result in having balance and posture. We also have somebody mentioning drooling, whereby the children are not even able to control because sensory input sometimes is cut off because the brain has to take sensory input and provide a feedback mechanism in terms of to correct that to the muscle works. But if there's a break, that systematic transition is not there, and we also result into that drooling. Next slide, please. Increased jerk reflexes. A reflex is an involuntary, automatic, and almost instantaneous response to a stimulus, which is a response. For instance, if I introduce something very hot, I introduce for you to touch, you will react instantaneously by withdrawing your hand. That is not conditioned anywhere. You don't have to think. You just have to do that. We have such reflexes because there is an interference with our sensory and motor movement are relating there. So you just find the movement being erratic. So we also have incontinence. Incontinence whereby they cannot control urine and sometimes fecal. We have continence coming in 2 dimensions, fecal and urine. So the muscles cannot hold because perhaps they are spastic. It is very difficult to control a spastic muscle. Okay, tremors. Tremors still also, there's some neurological conditions also which present with tremors, like Parkinson's disease. Has anybody among us seen Parkinson's disease? Parkinson's, you see the shuffling of the finger like this. Those are tremors. Okay, next slide, please. We also have the neurological symptoms, some of them we mentioned, behavioral, children with disability, because even the brain also, there's a part which deal with emotions and all that, learning and all that, the cerebral cortex. So the behavioral will automatically change if there's an injury to the brain. We also have delayed motor skills development, because this delayed motor skills is like the neck holding. You know, for you to sit down, first of all, you must be able to hold your neck. If you are unable to hold your neck is falling like this. First of all, there will be a delay, and that happens very often with people with cerebral palsy. Difficult with speech, that one we also said. And this difficulty with speech come along because speech, the muscles for articulations, and also we have speech centers within the brain. If they're also affected, definitely we'll have that speech and language deficit. We also have sensory impairment. Sensory impairment whereby maybe it is a touch, there's a way you are supposed to respond to touch. If there's too much pressure, there's a way you respond to that. So for this one, because we have other part of the brain which refine, they receive those sensory and send them to respective part of the brain to interpret and send a corrective feedback. So because of that, we end up having issue with sensory. Vision and hearing problem is also a common problem as far as cerebral palsy is concerned. There are so many factors. Initially, we also touched on that. There are so many factors. We don't have one specific factor that causes cerebral palsy. We have so many factors, and some of them are even not known up to now. Maybe I can also add something else about because we mentioned injury to an immature brain during and at birth. We also have after birth. After birth, postnatal, we have drowning experience, near drowning experience. When a child or an infant is almost drowning, he or she lacks oxygen for some time. If you deprive an oxygen for less than 5 minutes, is enough to cause brain injury, and a child can get that cerebral palsy. And this one we are told injury up to 3 years, because we are told up to 3 years the brain has developed 3/4. 3 years of our life, we have 3/4 of the brain already developed. So whenever that, we also have shaken baby syndrome. We have people, maybe you are playing with your child or an infant, you shake them so hard that indirect force can cause an injury to brain because they are not fully mature. So resulting into that CP. And also, we also have other issue like breech presentation. When normally a child should come with the head first, but in other cases the child present with legs first. So that in that process will also result in the brain being injured and also resulting into cerebral palsy. We also have infection like meningitis and pneumonia. Those are also things which can also result to brain injury, and also accident and physical assault. Abusing children through such physical assault can also result into that. Medical negligence. Medical negligence, for instance, there are some cases we've seen a mother goes to the nurse telling the nurse, I really feel the child is I'm almost due. The nurse sends the mother away. You are pretending or that your time is not yet. And some mothers end up giving birth even in toilets in some of the public hospitals I've seen before. So that may also result to cerebral palsy. So what shall one do if you are in such you are the one helping this particular mother? You should be very fast to keep the mother and the baby safe. So basically, those are types of cerebral palsy. We have ataxic type of cerebral palsy, and ataxic type of cerebral palsy, whereby the child walks with a staggering gait. I don't know if you've ever seen that. And then they walk on the toes because the muscle, because the brain, the cerebellum, that's also still on the cerebellum issue. The ataxic type of cerebral palsy is on the cerebellum part, which control movement and posture. We have athetoid. Athetoid is a result of muscle tone being affected, and which also, with athetoid CP will present with those movements. You see, when a child is trying to stand, you see movement even in their hand. They are trying to move that hand, and even the leg. We also have that being represented in the movement, even in the fingers. Those writhing movement. Even that child also coming to standing. You'll also see expression on the face. They are really struggling to come to standing, perhaps, because you can also see the face and also the tongue, also sometimes back and forth. So we have hypotonic CP. Hypotonic, we have low tone. Tone is tension in a muscle in its relaxed state. We've had so many in our setup, people say, I'm toning my muscle. There's some tension you want your muscle to have, not to be flappy. So we have the hypotonic, such kind of tone deficit can result into flaccid muscle being, I don't know how to really, they're not firm enough, so resulting to that type of CP. We have spastic cerebral palsy. Spastic cerebral palsy come from the word spasms. Spasms, these are involuntary movement, which in many cases they are jerk movement. Sudden jerk movement can also result into that. And for children with spastic cerebral palsy, because we have specific muscle being affected, the muscle in the inside of the thigh, they are being affected, being drawn closer to each other. So this particular child with spastic CP will move in a scissor-like that. That is the kind of movement we'll find. And again, sorry for, there's something still on the same spastic, the muscles are so tight with those jerk movement, some of them end up shortening. And that is why perhaps you also see they walk on toes. Sorry, it was on the athetoid, but spastic, whereby they walk on toes, because we have this muscle here, where it inserts down here, the tendon, the end, where it inserts into the bone. It becomes very tight, such that the child cannot put the sole down. So they walk in a scissor gait this way with the toes. So that is the type of cerebral. We also have the last one, mixed cerebral palsy, which is a combination of a number of those we've mentioned up there. And the treatment require a multidisciplinary team, and because we have other challenges like seizures. Seizures is also very common to children who've been affected severely by cerebral palsy. So how do we manage seizures? We have a pharmacological approach whereby we use drugs. Example of drugs we use for pharmacological management, church. Any pharmacist around? Any nurse? To relax spasticity. Kuna mtu anajua hiyo? Okay. Apparently, we have drugs like diazepam, which is a drug which is commonly used to manage that jerk movement. It inhibits some of We have chemicals which help in transmission of the signal in the nervous system. This one inhibits release of those particular chemical neurotransmitters. So the muscle relax. And once the muscle relax, you're able to do a lot, like from our end as physiotherapists. If a muscle is relaxed, you're able to train the child with a lot of ease, because we've seen people also rupture. If you force a spastic muscle sometime, unailazimisha kuikunja ama some people end up rupturing maybe the tendon Achilles. It does happen to some people. So we first of all use those drugs, because I have a similar case. They've used such kind, and the child is really attained in terms of mobility, because the child was difficult to even go to the gym and all that stuff. But now they enjoy life. Life has been made enjoyable. We have, we still on the same drug, we also have the kind of called botulinum toxin. It's a kind of bacteria that is injected to the spastic muscle. And once that is done, it relaxes the muscle, and you're able to do a lot of things. We also have the third, apart from pharmacological, we have rehabilitative approach. In rehabilitative approach, we use physical means. Physical means, by this I mean exercises. We also have assistive devices, which are given by orthopedics. We have, maybe the muscle is trying to shorten in this position, bent position. You come up with devices, you straighten, you work on that muscle, you relax it, and then straighten it, and then fix it in that position so that it doesn't shorten. Because once it's shortened, it will be difficult for you to stretch that spastic arm, because it may also need surgery for you to do that. We have the speech therapist there. Speech basically trained on the child too. For those who can take instruction, they are trained on pronunciation. Because initially, they also issue with the child with cerebral palsy. They also have difficulty even feeding. And feeding or sucking is the first precursor to speech. Because if the child or infant is able to wrap the mouth around the nipple, that wrapping of the mouth around the nipple when sucking is very helpful later when it comes to the issue with speech. Because that means rounding the mouth. When rounding the mouth, there are some letters, syllables, which can be pronounced. For instance, B and P. Those ones. Letter P and B for bus. And also M, letter M. Those ones you cannot pronounce without rounding your lip. So if a child is good, an infant is good in suckling, so later on, speech also is enhanced. We also have the speech therapist, I've said, the occupational therapist basically train the child or an infant in the activity of daily living, occupational, how to maneuver in an environment. That's why they come in very handy. And mostly they work with fine hand movement. Basically, they work from this area. This area alone in the brain, it has a very big representation, a very big part of the brain control this area from here to here than one entire leg, because of the very fine movement involved. So occupational therapists there become in handy. And for physiotherapists there, we also assess the challenges, available challenges. Also liaising we liaise with the parents or the guardian to come up with a plan. So if, for instance, is a delaying milestone. We have children with cerebral hypotonic type of cerebral palsy, where the neck just falls by the side. We try to use method to stimulate the muscle to try at least to work against gravity so that the child is able to attain milestone. And a number of them have attained. such milestone through such approach. The assistive devices I've already mentioned, and mobility aids. At times, we also look at some children. They need support. Like for the case of athetoid CP, because of variation of the tone, they will need something to hold on to, because they will not be able to do what? To stand or walk independently, most of them. So we have the other case. We have the surgical case. The surgical case is to correct the tight muscle. For instance, we have this tendon I told you, they walk on toes. It is elongated. A surgical process called tenotomy to elongate this particular tendon. So that is it. I think this, what I never mentioned there is routine vaccination. That's why they advise for our parents, mothers to go for vaccination. Those are preventive measures. Avoid drug and substance abuse. Any potential rhesus incompatibility, that's something also never mentioned about rhesus. Rhesus incompatibility is whereby we have a rhesus negative mother giving birth to a rhesus positive child. The mother's antibody identifies the baby as a foreign object and start attacking it. But that happened for subsequent cases, which can also result to that. So that's why they test. If you are a mother, you have that card, they perhaps might have asked you on rhesus issue thing. So that is it. The next slide, please. That is the end. I've been a bit faster, quick enough, or I don't know if I've been very slow. At this point in time, I request for questions. Maswali tafadhali. Kuna yule yuko kule mwisho, anaweza apewa kipaza sauti. Ama kuna jambo ambalo sijaelezea kwa ufasaha. Tafadhali, if there's an area you would want me to dwell a lot on, please, you can ask. It is an interactive session. I can reach you.
Good evening. You have spoken from a medical point of view. Assuming I'm a mother or an aunt to a cerebral palsy child, what should I do? What shouldn't I do socially in order to support them?
Any other question? Any other question, please?
Okay, I have two questions of the cases we usually see. There are those kids that they call their hyper, I mean they are more reactive. Are they part of this cerebral palsy class? Then there are those who stammer. I don't know whether that also can be part of that. And I'm asking myself, like now stammering, is there a way that somebody can be treated until he stops stammering? Or that is not possible?
Okay.
I was wondering, the way you've told us the symptoms and those things on how sometimes cerebral palsy is gotten, I was asking myself, if it is detected early the way you've mentioned, maybe probably during birth, ama mtoto alianguka, kitu kama hiyo, can it be cured completely, or there is an aspect that will still remain for them to be called like that?
I think for that I have to respond to this a few questions, and if there will be subsequent questions, please don't hesitate to raise them. The first question was, as a mother, how can you support the children with cerebral palsy? Well, that one, what you can support them, we have medication, we also have diet, the specific diet they require for them. We also have those other with issues. You play your role on that aspect, and also because they will also need regular physiotherapy and occupational therapy. You try as much as possible to ensure your child, as a mother, attends those particular clinics, because if cerebral palsy is mild, the outcome will be greater depending on how you intervene as a parent by availing your child to those particular clinics. We also have even neurological review. Sometimes there's fluctuation of even behavior. So you may also need neurological. As a mother, you'll have to really ensure you go for those clinics. Basically, that is it, unless, I don't know if your question has been answered.
In its relax.
The second question is about hyperactivity. Does it belong to this class of intellectual disability? Yes, it does. Because it's a behavioral, autism or hyperactivity is a behavioral disorder. It belong to this class of mental disability. Even though we have extreme cases of autistic children being geniuses, because there's like one case whereby an autistic child was taken through the street of London